What I like about the program here at UNMC is the people. That was a big attraction for me to come here. It was important for me to feel like the people valued education and valued teaching, future movement disorder specialists, and so that was impressed upon me from day one, even before I visited here with my phone conversations with Dr. Torres. And then on top of that, the program that they laid out was very comprehensive. I was a clinical track and then stayed around for the full DBS training, and that was the other main attractor for me to come here, as well as comprehensive deep brain stimulation training with Parkinson's disease patients, essential tremor, and dystonia as well, and that goes from patient selection to the workup, evaluation, the comprehensive DBS meetings that we have with neuropsychology, Dr. Follett, and then the programming once the leads have been placed. And on top of that, seeing patients in our regular clinics and being exposed to a diverse group of patients with different pathologies and different movement disorders.
One of the most important things that I like about this program is the amount of teaching that we have. So, for example, we have at least 3 hours per week of teaching, which is kind of unique when you compare with other programs. For example, we had 2 hours Wednesday, and we have 1 hour every Friday. So which is kind of unique in terms of when you compare with other programs. So I think I feel prepared after 1 year. In my case, I did the clinical track. There we have 2 tracks. We have the clinical track and we have the academic track. In the academic track, basically you do 2 or 3 years. In the clinical track, which is the one I did, basically you replace the time that you spend in research in clinical training. So, and this is one of the things that make me decide coming to this program, because they have a specialized training just for people like me, that not everybody is interested in working in an academic center.
So I have been actually at UNMC for 5 years now, because I came here to do my neurology residency before staying to do the movement disorder fellowship, and I think that it's been a great decision to stay for the fellowship, and I've been really happy with the training that I've had here.
I think the faculty here does an excellent job at teaching you what you need to know and guiding you with more supervision, obviously, when you're new, and then gradually progressing you to less and less supervision to the point where you're doing DBS programming on your own. They trust your clinical exam and your plans for botulinum toxin injections. It really is like a family here, close-knit people that enjoy working with each other, and as I mentioned, that was a big attractor for me in choosing UNMC from fellowship training, and I wasn't disappointed, I wasn't wrong in that, and it's very apparent from the start that everyone is here to provide excellent care to the patients, and they enjoy what they do, and they enjoy working with each other.
Always there for you. They will be available for you. What is important for you is important for them too, which is a great thing when you. So it's like a family. It's like a family, and I think just to summarize that I made the correct decision. I'm always, it's like, it's just 2 weeks to go, and I feel great, and this is one of the best decisions I have made.
I think what's most unique about the training program here is that we have a structured education program with formal didactics at least once a week, and this is definitely unique to our program. A lot of the other movement disorder programs in the country that may even be a little bit better known than our program, they don't have that structured education that we have. We also have comprehensive education in Botox, and we're one of the few programs in the country that is educated on using all of the different toxins. We have monthly meetings during didactic sessions that include the movement disorder team, the neuropsychology team, and neurosurgery, where we discuss the individual patients that are potential candidates for deep brain stimulation. And then the fellows also have the opportunity to go into the operating room, where we are definitely made to feel like we're an important part of the team in examining the patients during the procedure, and also in doing electrode recordings and mapping of the site where we're actually going to implant the electrode. So it's a really comprehensive education as far as deep brain stimulation. And we are also, as fellows, we gain a lot of independence as far as the programming of the stimulators after the surgery is done.
Dr. Torres is extremely passionate and energetic, and he really cares for his patients, and as well as really cares about teaching the future neurologists about movement disorders and how to properly care for those patients. And as soon as you meet him, you can tell that.
It was a good decision to stay here for my fellowship. I was able to get exactly the job that I want after this, and so I would recommend that other people come to the program.